Your hip flexors might be the hidden reason you feel stiff, weak, or constantly tight. If you sit for long hours, struggle with low back pain, tight hamstrings, poor posture, or even weak glutes, your hip flexors could be holding you back. And here's the problem. Most people are stretching them the wrong way. Your hip flexors are a group of muscles at the front of your hips. The main ones are the psoas and the iliacus, together called the iliopsoas, along with the rectus femoris. Their job is simple: lift your knee and bend your hip. But when you sit all day, these muscles stay in a shortened position. Over time, they adapt. They get tight, they get weak, and they start pulling your pelvis forward. That forward pull creates something called anterior pelvic tilt. Your lower back arches excessively, your glutes shut down, your core stops working efficiently, and suddenly you're dealing with back discomfort, hip stiffness, and poor movement mechanics. You stretch your hamstrings, you stretch your lower back, but nothing changes because the real problem is in the front of your hips. Now, here's the mistake most people make. They just drop into a deep lunge stretch and hold it for 30 seconds. And while that might feel good temporarily, it doesn't solve the issue. Tight doesn't always mean short. Often, tight muscles are weak and overworked. So instead of only stretching your hip flexors, you need to retrain them. So here's what to do instead. First, we activate and strengthen the opposing muscles, especially your glutes and deep core. Start with a simple glute bridge. Lie on your back, knees bent, feet flat. Before you lift your hips, tuck your pelvis slightly. Think about flattening your lower back into the floor. Then, squeeze your glutes and lift your hips. Hold for 2 seconds, lower slowly. Do 10 to 15 controlled reps. This teaches your body to use your glutes instead of letting your hip flexors dominate. Next, we mobilize with control. Get into a half kneeling position, one knee down, one foot forward. Instead of leaning forward aggressively, gently tuck your pelvis first. That small posterior tilt is key. Then shift forward slightly while squeezing the glute of the back leg. Raise the arm on the kneeling side and reach up and slightly over. Breathe deeply, 5 slow breaths. This turns a passive stretch into an active reset. Then we strengthen the hip flexors properly. Yes, strengthen them. Lie on your back and perform controlled leg marches. Keep your lower back pressed gently into the floor. Lift one knee to 90 degrees without letting your pelvis tilt. Lower slowly. Alternate sides. This builds strength in a lengthened, controlled position, exactly what your hips need. And finally, stand up and move. Do slow step-ups or controlled lunges while maintaining a neutral pelvis. Focus on alignment. Focus on control. Your hips need strength through movement, not just flexibility. If you do these 4 things consistently, activate the glutes, control the pelvis, mobilize with intention, and strengthen through range, you'll notice something powerful. Your posture improves, your low back feels lighter, your stride feels longer, squats feel stronger, even your balance improves. Because when your hip flexors stop fighting your body, everything moves better. Remember, this isn't about aggressively stretching every day. It's about restoring balance. Your hips are the center of your body. If they're off, everything above and below compensates. So if you sit a lot, train hard, or feel constantly tight in the front of your hips, stop chasing stretches. Fix the root cause. Reset your hips. Strengthen what's weak. Control what's unstable. Your hip flexors aren't the enemy. They just need the right kind of attention. Try this routine for 2 weeks, just 5 to 10 minutes a day, and notice how your body feels. If this helped you, make sure you subscribe for more movement and mobility tips. Comment below if you want a follow-along version of this routine. And remember, move better, feel better, live stronger.